Hello, my name is Misha Agansan. I'm a licensed health insurance specialist. After 10 years in the field, I realized that insurance can seem complicated and confusing for many people. That's why I decided to open my own agency, to help people not only choose the right insurance, but also understand how to use it when they really need it. I often see how insurance can be overwhelming and raise many questions. This is completely normal. My team and I will explain everything in simple terms and help you choose the right plan that best fits to you and your family. Our consultations are always free. If you have any questions, please give us a call. We are always ready to help. In this video, I will break down the most important questions about health insurance in simple terms. If anything isn't clear, feel free to leave a comment. Are you ready? Let's get into it. What is health insurance? Health insurance is the way to protect yourself from high medical expenses. It helps you to avoid paying everything out of pocket. The insurance company covers parts of the costs, for example, doctor visits, hospital stays, surgeries, or medication. Usually, dental and vision care are not included in health insurance, but it depends on the plan and the state you live in. The main goal of insurance is to make healthcare affordable and relieve you from unnecessary financial stress. What are the different types of health insurance? There are several types of health insurance. Government program including Medicare, which is for people over 65 and some individuals with disabilities, and Medicaid, which is for the people with low income. It's important not to confuse this program, as they are designed to different group of people. Private insurance is divided into individual plans, where a person can buy a plan independently to the state's marketplace, and group plans, which are provided by employer. There are also special types of insurance, such as dental insurance, which covers dental services, and vision insurance, which covers eye exams and the purchase of glasses or contact lenses. What are the key factors to consider when choosing health insurance? There are several key factors that affect the process of choosing health insurance. First, your place of residence. Available plans depends on the zip code or state where you live. Family status is also important, as it determines whether you need individual or family health insurance plan. Age influences the cost of insurance, as older individuals are often pay more. And of course, income is a key factor. The lower income is, the more likely you are qualified for subsidies to the state's marketplace, which can significantly reduce the overall healthcare costs. What documents are needed to apply for health insurance? First of all, you need to confirm your immigration status. This can be a green card, work permit, passport, or any other document that verifies that your legal stay in the country. Proof of income will be required. If you work under W-2 basis, this could be your employment verification letter, pay stubs, or tax returns. If you have your own business or you are self-employed, it's recommended to consult with your accountant to proper reporting of personal income. It's important to know that if you're legally married, your income will be considered family income. To apply for health insurance through the marketplace, be sure to file joint tax return, married filing jointly, for subsidies to be applied. Also, you need to provide social security number. Additionally, you need to provide your current address and of course contact information, phone number and email. What should you pay attention to when choosing a health insurance plan? Firstly, pay attention for the cost, premium. This is the monthly payment for the insurance. If subsidies are available through marketplace, they may help reduce the price. In some cases, you might even qualify for the free plan depending on your income and family size. You should also consider additional out-of-pocket costs when using the insurance. For example, deductible. Deductible is the amount you pay for certain medical services before the insurance company starts covering the expense. If the deductible is $1,000, you must pay the amount before the insurance starts covering the remaining costs. Typically, the deductible is paid after the medical service is provided. The insurance company does not pay to the clinic, but informs the clinic that the patient must pay for the procedure. The clinic will send you a bill by mail, which you will need to pay directly to the clinic where the procedure was done. You don't have to pay deductible right away. You're gonna pay it during the year, little by little, and depends on the medical services you use. In addition, there is a copayment. It's a fixed amount you pay for doctor visit or medication. For example, if your doctor visit $150 and your copayment is $20, you pay only $20. The insurance covers the rest. There is also coinsurance. Coinsurance is a percentage of the cost that you pay. Coinsurance usually applies for more serious medical services such as MRI, surgery, hospital stay. For example, if your coinsurance is 20% and your surgery costs $2,500, you will pay $500, and the insurance covers the remaining amount. It's important to remember that cost of services will be determined by the insurance plan, not by the doctor or clinic. Usually, whenever you have insurance, it's more beneficial for you. Most likely, you will pay less than without it. Finally, pay attention to out-of-pocket maximum costs. This is the maximum amount you can spend during the year. For example, if your out-of-pocket maximum is $5,000, this means that once you spend this amount on copayments, coinsurance and deductible, the insurance will pay remaining expense for the entire year, 100%. For example, if your hospital bill is $30,000, you'll pay maximum only $5,000. Don't forget to check whether your doctors and hospitals are included in network of the plan you choose. If your doctor is not in network, you will pay more for these services, and sometimes you can pay full amount, 100%. It's important to remember that marketplace plans only works in the state that you live in. All other states, it will cover only emergency. Also pay attention for the coverage and services included in the plan, such as medication. For example, if you need to take medication regularly, make sure they are covered by your plan to avoid additional costs. How to understand the coverage level of health insurance plan? There are several coverage levels of health insurance plans, known as metal tiers. The bronze plan covers 60% of expense and has low monthly costs, but you will pay more if you need to visit the doctor. It's suitable for healthy individuals who don't visit doctor that often. Silver plan covers 70% of expense and has an average cost. This is a good option for most people as it balances between price and coverage. The gold plan covers 80% of expenses and has higher monthly cost, but you pay less when visiting a doctor. It's the best choice for those who often need medical care. The platinum plan covers 90% of expense, but very high monthly payments. Also, you pay less for doctor visits. It's perfectly for those who frequently go to doctors and want to minimize costs. When choosing a plan, consider how much you're willing to spend each month and how often you need medical care. What are types of health insurance plans? There are several main types of health insurance plans, which differs in coverage levels and usage condition. In HMO plans, you must choose a primary care physician who will refer you to specialists. You can only visit doctors and clinics that are in network, but your monthly payment will be low. In PPO plan, you can visit doctors and specialists without a referral from your primary care physician. You can choose in-network and out-of-network providers. However, out-of-network provider, you'll have to pay more. PPO plans are often provided by employers, but they're also available in some states through marketplace, usually at higher cost per month. In EPO plan, you can also visit specialists without a referral from your primary physician, but this plan doesn't cover out-of-network services except in emergencies. How to properly use your insurance? First of all, choose a doctor or clinic. Make sure they're in network with your health insurance. You can check this online on the insurance company website or by calling the doctor's office. Next, find out what exactly the plan covers. For example, doctor visits, prescriptions, tests, or hospitalization. It's also important to determine which services may require additional out-of-pocket costs to avoid surprises. When scheduling procedure, clarify any potential extra payments before the visit. If the service falls under deductible or coinsurance, you'll be informed, but it's not always possible to predict the exact amount before the visit. The clinic or insurance company will help you to navigate this. If you're insured through state marketplace, don't forget to update the information. If anything has changed during the year, such as income or marital status, be sure to report it within 30 days. This will help you to keep your insurance up to date and avoid additional out-of-pocket costs that may arrive when filing your tax return. Thank you so much for watching this video. If you have any questions about health insurance or need to help choosing a plan, we are here to help. We operate in over 10 states and offer free consultation at every step. Contact us and we will assist you in making the right choice.